Okay, welcome everybody. Wow, this microphone works really well. Okay, well, welcome to another installment of CIH Community Health Talk. My name is Gail Fornacier, and I'm the Director of Community Outreach at Catalina Island Health. The goal of these health talks is to promote health and wellness in our beloved island community, and tonight we'll be learning about diabetes from Dr. Aimee Warren. Dr. Warren is a board-certified visiting family medicine physician at CIH. She is a graduate of Midwestern University, Arizona College of Osteopathic Medicine, and did her residency at the University of Nevada, Reno. And from 2016 to 2021, she served as CIH's Chief of Staff. Currently, she is on island to see patients a couple of days, most weeks, and is available for both clinic and med spa visits. Help me welcome Dr. Warren.
Just because you don't. This is Sal. I'm sure everybody knows, but
Good evening, everybody.
he's what keeps our clinic running. So he's going to help me with Spanish because my Spanish is not so strong. So just help with if just in case anybody's watching online. So as Gail mentioned, I work at the clinic. I think I recognize most everybody in here, but I'm Dr. Aimee Warren, and I've worked at the clinic for almost 9 years now, and I've sort of gone from full-time and sort of swung back and forth. Now I'm mostly part-time, but I'm there 2 days a week, and we have such a great crew right now of providers, physicians, and Santa's our nurse practitioner. She's there all the time, and it's just such a strong crew, so I really encourage everybody to come and see us and utilize our services because it's really important that we all support each other, and community health is something that we're all really passionate about. So today we're going to talk about preventing and managing diabetes, and this is really your time, so you can always interject and ask questions, or don't feel like you have to wait to the end. If you have a question, just stop me. I'm fine with that.
La doctora Warren ahora va a hablar acerca de previniendo y gerente de bajo control. Si tiene alguien alguna pregunta o algo,
we're going to start with who is at risk. So primarily it's having a parent, sibling, a close relative. That definitely puts you at a higher risk for developing diabetes. I would say, because of this, it's a lot because we eat the same things, so it's in the household. We're all kind of eating the same things. The excess body weight, just having excess body weight really significantly increases your risk of insulin resistance and potentially type 2 diabetes, which we'll get into a little bit. And a sedentary lifestyle really increases the risk. So it's all about lifestyle. It's your diet. It's how much you're moving your body.
ella explica un poco de quién está en riesgo de la diabetes tipo 2. Tener un familiar, ya sea un hermano, un padre o mamá o alguien cercano con diabetes aumenta el riesgo. También el exceso de peso corporal aumenta significativamente el riesgo. Un estilo de vida sedentario aumenta el riesgo también.
So and I got this data from the National Diabetes Institute, the NIH, and it's 30 million people in 2023 are currently diagnosed with diabetes, and 80 million people with prediabetes, that's insulin resistance. And that's just the people that have been diagnosed. There's a lot of people walking around don't know that they have it, especially prediabetes. And in 2050, suggested that 1 in 3 adults will have diabetes. So again, going to the risk factors, certain ethnicities have a higher risk. So Hispanic, Pacific Islanders, Asian people tend to have a higher prevalence of diabetes and a higher risk. And I would say, it's partially due to genetics for sure, but it's partially due to a shared lifestyle, shared foods, shared activity, that kind of thing.
El diabético 2, ella agarró esta información en el 2020-23, 30,000 personas fueron diagnosticadas con diabetes. Prediabetes, que eran prediabéticos. Para el 2020-50, 1 de cada 3 personas en adultos tendrá diabetes. Ciertas éticas tienen un mayor riesgo, especialmente en la comunidad hispanos, en parte debido a la genética y en parte también debido al estilo de vida que compartimos, ya sea que la comida que todos comemos, todas las compartimos, estamos más a riesgo de atraer el diabetes.
Many families are affected, but diabetes is definitely preventable, type 2. So you have the power to prevent diabetes, and we're going to take control of our health together.
El diabetes se puede controlar y es una de las cosas es tratando de cuidar nuestra salud, el poder de controlar, prevenir la diabetes.
Good. We're going to start with what is diabetes, and this is just really going to be pretty general, but essentially it's when the body can't use sugar or glucose properly due to insulin resistance. And high blood sugar over time, so our cells aren't taking in that blood sugar. High blood sugar over time, it damages the heart, the kidneys, the eyes, the nerves. So diabetic neuropathies, eye problems, heart disease, kidney problems, these are very common complications of diabetes that can be prevented, and this is what we're going to talk about.
Ahorita ella va a hablar de qué es el diabetes. El cuerpo puede utilizar el azúcar, la glucosa, correctamente debido a la resistencia a la insulina, y los niveles altos de azúcar en la sangre con el tiempo dañan el corazón, los riñones, los ojos y los nervios.
So we're not going to get too in depth here, but I just wanted to talk about the mechanism of action of insulin, because I think sometimes it can just, I'm a visual person, it kind of helps me think about this in a way that makes sense to my brain. So insulin is sort of like a key, and the insulin is excreted from the pancreas, and it helps our cells see the glucose around. So these little blue squares, that's representing blood sugar or glucose. So if there's no insulin around, the cell is sort of blinded by, it can't accept that glucose in and use it for all the cell function. Insulin, if you'll see here, there's a little receptor. If your cell is working properly, the insulin will go to that keyhole, open that glucose channel, and the glucose can go into the cell and be utilized. I don't know if you want to say.
Y ella está enseñando el mecanismo de la acción que hace la insulina. Si miran hacia la pantalla, esa es la llave que es la insulina. Cuando pone la llave en la insulina, los cuadritos azules que se miran viene siendo la glucosa. Si miran a la siguiente imagen, ya cuando la llave se pone donde está, viene siendo la insulina y abre el otro lado. Y es donde empieza a salir la azúcar.
I kind of sandbagged you with that one. So this is the blue dots, right? This is the sugar. This is where the sugar comes from, and it comes from, all foods have some sort of carbs in there, most foods, but these are the ones that are going to really spike your blood sugar. These are the carbs. So I would say most of my patients aren't big sugar people. It's more of a carb issue. So it's the Takis, it's our pasta, it's our white rice, bread, tortilla chips, cupcakes, donuts. These are the things that really increase our blood sugar.
Estos son unos ejemplos de lo que causa que los niveles de azúcar suban. Por ejemplo, los taquis, las pastas, tortillas, los chips, el pan y todos los carbohidratos.
And if you can just take one thing from tonight, if you're a soda drinker, if you can just cut that out, you're going to make a huge positive impact on your blood sugar and your risk of getting diabetes. So sugar, sodas, they have so much sugar in there, and most of the time we're just drinking a soda and then also eating a meal. So it's not going to replace the meal, it's on top of that. And it just, if you see, I've worn a continuous glucose monitor and watched blood sugar just spike even with a piece of sourdough bread. So if you imagine if you're drinking a Coca-Cola, how that's just gonna really shoot your blood sugar up, and over time your body just can't handle so much sugar load.
How about if you have a diet-free?
Diet?
Sugar-free soda?
Yeah, that's better for sure. I mean, it's still, I still think it's not very good for your kidneys, it's not very good for your body, water's better, but it's definitely better than the full sugar soda for sure.
Dice que lo primero que ella le gustaría que hicieran, si quisieran dejar poco a poco, empezar a dejar estos ejemplos de comer para que les ayuden con los niveles de azúcar, sería el refresco. El refresco contiene bastante azúcar que le subiría sus niveles de azúcar, aparte de comer un platillo de lo que esté comiendo, ya sea almorzando o cenando. So, si deja de tomar el refresco, sería una gran ayuda a ayudarle a controlar sus niveles de azúcar.
Remember these blue dots? And this is what your inside of a cell or inside of your artery or vein, or it's inside. You're looking on the inside of a vessel, okay? And here on this side of the screen, you'll see low blood sugar. In the middle is normal, and then hyperglycemia means too high blood sugar, and that's all the little blue dots floating around in your bloodstream.
Si miran la imagen que tiene ella ahorita, enseña tres diferentes ejemplos de cómo se mira si estuviera mirando hacia adentro de una arteria. La primera le enseña los puntos azules son el azúcar, esa es la azúcar baja. La del medio sería como se mirara si tuviera sus niveles de azúcar normales. Y la última es como se miraría cuando tiene su azúcar alta.
So this is what your blood looks like when you drink a soda or have a big piece of, high carb meal, a big piece of bread. This is what happens, and why does it matter? So you can imagine that sugar load over time, it's going to affect those tiny arteries and vessels in your eyes, it's going to affect your heart, it's going to affect your kidneys. So it just puts a lot of stress on the body. We also know that high blood sugar increases your risk of Alzheimer's disease. So we're now kind of equating Alzheimer's and calling it type 3 diabetes, because we know the mechanism is the same. What's happening in the brain, what's happening in the body with type 2 diabetes. So it affects your overall quality of life, and it affects our longevity. So this is why it matters, because it's going to affect how long you live and how well you live.
Y aquí ella está diciendo por qué la diabetes por qué causa la diabetes. Aumenta el riesgo de enfermedad del Alzheimer en adultos mayores de edad. Conduce a enfermedades cardíacas, accidentes cerebrovasculares, insuficiencia renal y daño a los nervios, y afecta la calidad de vida y la vida larga.
But this is the good news, right? We used to feel like Alzheimer's is sort of this scary kind of thing that might happen to us as we age, but now we know we have some agency over this, and we have some power over how our health ends up as we age. So this is really good news. We know how to prevent this. So I wanted to go just for a quick slide on symptoms to watch out for. So these are the most common. It's a sense of always thirsty, like you're drinking so much water, but you can never feel satiated. Increased urination. This is one of the more common ones that I see in the clinic, is just going all the time. Fatigue, just feeling like your wind is out of your sails. It's a really common symptom. Blurry vision is another one. And then slow healing cuts or wounds. And for women, recurrent yeast infections is a really common symptom of diabetes.
Estos son unos ejemplos de síntomas a tener en cuenta. Siempre le da sed. Frecuentemente tiene que ir a orinar. La fatiga, visión borrosa y cortes de curación lenta. Por ejemplo, si tiene una cortadura o algo, le dura más tiempo en sanar.
Going to the prevention side, food is the best medicine. So this is how we prevent and how we treat diabetes. It's really all about what we're putting in our mouths. So there's a myth that I don't eat a lot of sugar, so I won't get diabetes. And the truth is, it's like we talked about before, it's primarily the carbs. So most of us know we can't eat a bunch of sugar, but it's the carbs. That's the main thing that I see in my patients that really causes this insulin resistance cascade to start.
Y estos son la comida es el mejor medicamento. Dice que ella conoce un mito que dice no como mucho azúcar para no tener diabetes, pero en realidad lo que causa todo esto es los carbohidratos que comemos del día al día, y la verdad es seleccionando una comida más saludable.
So I say unhealthy carbs because that's another sort of myth that diabetics cannot eat any carbs, and that's really not the case. Whole grain carbs are the best kind. So what happens when you take, say for example, a whole grain piece of bread and a white piece of bread, you're essentially stripping out all that fiber, and fiber is what really keeps your blood sugar at bay. You're creating this product that all of the fiber is taken out, and it just, as soon as you eat it and it goes into your digestive system, it just gets broken down directly into sugar. There's no slowing. Fiber is like a turn down the volume of metabolism. It really helps to slow the metabolism of that food and helps to keep your blood sugars more even. Sorry.
Y dice que muchos diabéticos tienen en su pensamiento que no pueden comer carbohidratos, pero en realidad sí pueden comer carbohidratos. Son ciertos carbohidratos. Por ejemplo, en vez de comer un pan blanco, puede comer un pan integral, porque ese contiene la fibra que le va a ayudar a que su metabolismo funcione un poco más despacio, pero le ayude a controlar sus niveles de azúcar.
Nice. So the right kind of carbs, whole beans instead of refried, or so whole beans kind of made at home, that's the best kind. Lentils, quinoa, veggies, these are all really good carbs that you can have that aren't going to spike your blood sugar.
Estos son ejemplos de carbohidratos que pueden comer, por ejemplo, frijoles enteros, ya sean cocidos, no fritos, lentejas, la quinoa, vegetales, por ejemplo, espinaca, peppers, nopales, verduras puede ser espinacas, pimientas y nopales.
Any favorite question?
Sure. Yeah, so that's a good question. So rice. So you want to watch the portion sizes for sure, but like the whole grain brown rice, the what's the one called? With the black rice, it's like a, what's that one called? Yeah, but there's like another one that's like, I don't know. So there's just the ones that have color to it, you know, that don't have the husk removed. So, yeah, so, but even with brown rice, you know, there's other types of like the wild rices and, you know, there's one in my head that I'm thinking of, it's like purple, but so again, rice is it is a carb, so you just, again, have to watch the portion size of that, but you're gonna be way better off if you do the whole grain version versus the white rice. So these are good foods to swap. So instead of white rice, trying to use quinoa or brown rice. Instead of white tortillas, use corn. And then again, watching the portion sizes on that. Better yet is using lettuce wraps. And then sugary drinks. Again, if there's one thing that you can make a change today that was gonna really impact your health for the long term, is taking out sugary drinks. That's in Starbucks, that's your sodas, all of those things. And then using, you know, water with lime cucumber, just bubbly waters. Trying not to add those sugary creamers to our coffee. You know, we think it's such a small amount, but if you look at the amount of sugar in just a tablespoon or two of those creamers for your coffee, there's a lot of sugar in that. So just start being a good label reader. Look on the back of the whatever product you're buying, and make sure that sugar content isn't too high. And my rule of thumb for myself and my kids, it's like if it's more than 7 grams of sugar, it's off the table. So that's kind of my rule of thumb as far as servings.
Aquí enseña unos alimentos para intercambiar. En vez de arroz blanco, usar quinoa o arroz integral. En vez de usar la tortilla blanca, usar tortillas de maíz o lo que es la lechuga. En vez de tomar bebidas que contengan azúcar, a tomar agua con limón o pepino. Y ella también está diciendo que la crema que usamos para el café contiene mucha azúcar. Una regla que ella tiene en su casa, si contiene más de 7 gramos de azúcar, no lo usan en su casa. So dice que tratemos de leer las indicaciones y lo que contiene el alimento que vamos a consumir para asegurarnos que no contenga tanta azúcar.
¿Cuáles son las tortillas?
Sí, tortillas de maíz. Ella tortillas de harina quiso poner ahí.
How did I say it wrong? What did I
She's
say?
like, which ones are the white tortillas? Flour tortillas.
Oh, okay, yes. There's another, oh.
You said it's more than 7 grams. You're both putting this off the table. How many grams is in a serving size of soda?
I would say like up in the 40s. Yeah, 30s or 40s. Maybe somebody can look that up and fact check me, but I think in a you know, a bottle of Coca-Cola, it's like in the 30s. It was my guess. Are you looking it up, Santa? Fact check me. 39 grams. Mm-hmm. Yeah, so that and a 7 grams of sugar soda, like if you see those new poppies or those new kind of sodas that are around that are lower sugar, they're still really sweet. So 30 something grams of sugar in a soda is nuts to me. Like it just is wreaking havoc in your body.
Her own, let's say, water, and she puts fruits in it, and she puts sugar in it. Same amount of sugar that we would have in a soda.
So if you're making it yourself, you have control over that, right? So instead of putting actual white sugar, maybe using like a natural monk fruit or stevia or something of that nature, or just using the sugar, the fruit. The fruit by itself is sweet. So it's better than the soda for sure. That's a good idea to do at home.
So dice que usemos el stevia o usar la misma azúcar que contiene la fruta en vez de agregarle más azúcar.
It depends on the product. So the question was, you know, sugar-free, you know, there was a question about the sugar-free sodas. So I there's some controversy about stevia. I tend to think it's okay. You know, if I'm gonna let my kids have something, I'd rather them have that than a sugary soda. So just looking at the label, aspartame, those types of fake sugars are terrible. But if you can, there's lots of products being made with monk fruit now, and monk fruit is like it's a fruit, but it's no calorie, and it's sweet, and it's, you know, they're using a lot in products, and that's healthy. I think that's a nice alternative. So you just really have to read the label and see what they're using.
Does it make a difference if you take your walk 10 minutes after dinner, or if you take it 2 hours later?
It's better if you do it right off the bat. You know, you don't, there's no fast rule. I think 10-minute walk 2 hours later is better than no walk at all. But this is when your body's starting to process all of that sugar that you just ate, right? So the more you can get up and move, your body's just gonna process it a little bit better. So, you know, again, kind of going back to that CGM, that continuous glucose monitor, that was one thing that I really noticed for myself. I wanted to wear it because I wanted to see what my body does, and I would encourage all of you to do that. If you want to try that and come into the clinic, and I'll order it for you, and you can just wear it and see what your body's doing with different types of foods. I think it's really enlightening. Even if you have no concern about diabetes at all because you're a healthy person or whatever, I just think it's really enlightening. It helped me know, again, that I ate one slice of sourdough bread for lunch, and it really spiked my blood sugar. And then I really noticed I felt terrible too. I felt tired and sluggish. So it really made me connect between how I was feeling and the foods that I ate. And then I took a hot lap around the office, 10 minutes, and it really helped my blood sugar come right back down, and I felt energized. I felt better. So it's just that real-time data that you're getting from what's going on inside your body, how you're feeling, what foods do to your body, because it's going to be different for everyone. It's just a really powerful lifestyle tool to use. If you're interested in doing that, you should come see us. Okay, so just as food is medicine, movement is also medicine. So we just talked about the 10 minutes of walking after meals really helps lower blood sugar. So that's something simple that you can start doing now that will positively impact your health. Dancing, walking, playing soccer with your kids, all of that counts. So when you look at these areas in the world that people tend to live the longest, they're not necessarily going to the gym for an hour. They're just moving their bodies. They're mowing their lawns. They're walking to the market. They're playing with their kids. So it all counts, and it all helps. So setting small goals, I'm a big advocate for small bite-sized goals that you can add on over time, because if we just say, now you're all gonna eat no sugar and exercise a ton a day, nobody's gonna do it, right? But if you can do one thing, cut out the soda and walk 10 minutes after one meal, you're winning. So these are easy things you can do.
Aquí ella da ejemplos que el movimiento es como una medicina también. Por ejemplo, con solo caminar 10 minutos después de las comidas reduce el azúcar en la sangre. Por ejemplo, también bailar, caminar o jugar fútbol con los niños también cuenta mucho. Y tener objetivos pequeños, ir empezando como caminar 10 minutos después de cenar, le ayudará a tener sus niveles de azúcar bajo control.
Just a quick slide on childhood obesity and family health. So we know that kids with overweight parents have a higher risk of diabetes. So the things that you're doing in your own home, your body habitus affects your kids. And overweight kids have a higher risk of developing diabetes and other chronic medical problems. So this is why diabetes tends to run in families, is because we're eating the same things and we're doing the same things. We're exercising or not together. We're all in front of the TVs and on our phones, or we're all outside playing. So this is kind of how these things happen. So you guys just being here, this can be a major shift in your family, and you guys are the change makers. You guys are going to be the ones that makes these changes in your homes that impacts the people around you a lot.
Aquí ella también está hablando un poco de la obesidad en niños y en la salud de la familia. Niños que están sobrepeso, que tienen padres que tienen sobrepeso, tienen un riesgo más alto a ser diabéticos. Y los niños con sobrepeso también tienen el riesgo de tener diabetes y otros problemas médicos.
Be the change, and we set the tone as a family. So cooking meals together is a great way to connect with your kids, with your family. Replacing chips with fruit and nuts. So if it's not in the home, it's not going to be as easily accessible. So if you're doing the shopping, it's up to you to make sure it's not in your pantry. Swapping soda for fruit-infused water, moving together, walking, dancing, playing. So these are all things that we've talked about, but they're not earth-shattering. These are simple things that we can do that really make a big difference for yourself and your families.
Aquí ella habla de cómo hacer el cambio y todo empieza por nosotros mismos. Por ejemplo, cocinar en familia todos, reemplazar lo que es las sabritas por fruta y algún tipo de nuez, cambiar la soda o el refresco por aguas con frutas. Tratar de moverse uno caminando, ya sea jugando fútbol o jugando con los niños.
That's all right.
You keep saying they have, people say eat fruit, and then you hear fruit's got sugar, fruit's got lots of sugar, fruit's got so.
Good question. So the question was about fruit. So I rarely tell my patients don't eat fruit. It's watermelon, those are kind of the higher sugary fruits. But again, going back to that fiber thing. So if you have fiber in there, it's going to slow the metabolism and slow the blood sugar spike. So berries and apples and oranges, these have a lot of fiber in it. So yes, it might have some fructose sugar in it, but it's not the white processed kind, and your body just does better with it. So I never tell my patients that they can't have fruit. I'm a fruit advocate.
Is there a supplement you recommend to get fiber in your diet on top of
Yeah. So I think I could talk for a whole hour on fiber. So I think fiber is a superfood. If you can do anything, if you're looking to lose weight or looking to lower your risk of diabetes or high blood pressure or decrease your risk of heart disease, start counting your fiber. If you're a perimenopausal or menopausal woman, you should start counting your fiber because it's so important for our gut microbiome, and we know our gut microbiome plays such a huge role in hormone balance and immune function and metabolism and blood sugar and all the things. So fiber is such a good thing to start paying attention to, and if you can get 30 grams a day, that is amazing. That's the goal. And I'd rather you get it in through your food, because when you take a supplement, you're still going to eat, right? So the more you can get it in through your food, you're going to kind of crowd out some of that bad, those not so healthy choices. And if you start doing this at home and, print out, Google at home when you get home tonight, list of high fiber foods and put it on your fridge, and you start counting. 30 grams is a heck of a lot of food. And so you're going to be like, gosh, she's asking me to eat a lot. And that's the point, but you're eating good stuff. So you're not starving, you're not feeling deprived, you're eating a lot of food, and you're doing such good things for your health. So yes, you can do a fiber supplement, but you're going to do way better if you try to get that in through your foods. So small changes, big impact. So you don't have to be perfect, just a little bit better. Going back to those small habits over time, if you can, just choose one thing and do it well for a week or even a month, and then you do the next thing for a week or a month, and you just kind of add on. By this time next year, your body could be a whole different body, So these are small things that you can do that really make a big impact. So pick one habit to start this week. I'll walk after dinner, drink more water instead of soda. I don't like that one as much. I should have changed that because I'm more about actionable, real things. So it's when we say, I'm going to drink more water instead of soda, we're less likely to do it versus if we say, instead of a soda every day, if you're drinking every day, and I'm going to say, I'm going to have a soda, let myself have one Monday and Wednesday, and then Tuesday, Thursday, Friday, Saturday, Sunday, I'm going to have water. So have it be really, really succinct on what you're going to do. I'll eat 3 whole fruits and 3 whole veggies this week.
Aquí hay unos ejemplos de pequeños cambios que hacen un gran impacto en uno. No tiene que ser perfecto, solo un poco mejor. Elija un hábito para comenzar, por ejemplo, esta semana. Caminaré después de cenar, beberé más agua en lugar de refresco. Lo que ella dice es que tener como un hábito donde diga, si toma refresco todos los días, decir, el lunes sí tomo refresco, pero martes y miércoles no voy a tomar. Y esta semana comeré 3 frutas enteras y 3 verduras enteras. Poco a poco va a ser el cambio y de aquí a un año su cuerpo va a ir mirando la diferencia y uno como persona se va a sentir diferente.
Of saying the same thing again, but small changes today, longer, healthier life. Your health is in your hands. This is really meant to be empowering, that you can change the trajectory of your life, of your family's life, and it really just can reverberate through generations, really. You know, so it has to start somewhere, and these small changes that you can start making, it really impacts the people around you.
Y aquí toma el control de tu salud. Tu salud está en tus manos. Pequeños cambios hoy serían vida más larga y saludable. Y sean un ejemplo para su familia y para su comunidad.
So knowledge is power. Make an appointment to talk about your health. We're here to help you out with this. And, you know, everybody in the clinic is so great at helping our patients and empowering them to prevent diabetes and managing it. You know, there's, of course, lots of medications that we didn't even get into, but this is really about taking power of the things that you have control over in your home. These are lifestyle changes that make a big impact. So using the clinic as a valuable resource to support you and your family, we're here to help. We're here to support you. And taking charge of your health, remember, small changes over time make the biggest impact.
Y aquí el conocimiento es poder. Si necesitan hacer una cita, hablen a la clínica, estamos aquí para ayudarlos. La clínica es un lugar donde le podemos ayudar con recursos y ayuda para sus familiares. Uno debe tomar su salud en sus manos de uno. Y recordar que siempre los cambios más pequeños, por más pequeños que sean, con el tiempo le ayudarán a tener una vida saludable.
That's it. To leave enough time for blood sugar. We brought the supplies. If anybody wants to have their blood sugar taken, it's just a little finger prick, and it's going to be, of course, a non-fasting, which is okay. It helps us to kind of see where you're at with that. But that's free for anybody who wants to do that. And yeah, go ahead, a question.
Yeah, in terms of resources, like on the island, do we have, or is it possible if it would be beneficial to have a nutritionist come like once a month or something to help people?
That would be amazing. We would love that. We've talked about that so many times. But yeah, I mean, are you a nutritionist? Is that why? Oh. Yeah, it's hard. No, yeah, I mean, we definitely would love to have that. It's really hard to keep that person here full-time, even if they came out a week, there's been a lot of challenges. We've tried to do that a couple of times, and it just sort of, like everything, it kind of comes and it goes. It doesn't quite stick around, but that is such a huge piece of helping patients manage their diabetes and preventing. So it's something that's always on our radar. And if you have somebody that or if you have any suggestions, I think.
This is amazing.
Yeah. Yeah. Well, keep coming, and we'll keep doing it. So spread the word, and we this is what we're all about at the clinic. We really are invested in helping the community be healthier, and this is, everybody's here, everybody's off, but everybody's here, so all the providers are here, and it's because they care so much. And so the more you can spread the word and, fill it up, will come. Yeah.
So something like, I was told like apples and peanut butter.
Just watch the peanut butter, make sure it's not like Skippy with the sugar in it. Natural peanut butter. This is how Santa and I eat. Like, if you come into our office, we're like squirrels. We eat all day long, but this is what we eat. We eat apples with peanut butter, carrots with hummus, different snacks throughout the day that are healthier, and it really trying to stay away from those highly processed foods. That's the main thing. Yeah.
So I guess like to keep your blood sugar stable, is it better to eat those smaller meals like throughout the day as opposed to like larger?
That's how my body responds the best. I think everybody kind of has their own opinion about that, but I think that's how I tend to try to live my life, is eat my biggest meal earlier in the day, so I'm not eating a big meal at night and then going to bed. Some people, it just logistically, that's all they can manage. So I'm not like a hard and fast kind of person. I think everybody has to do what's right for your own life, and listen to your body. I think that's the biggest thing, is like paying attention to how your body feels after you eat something. There's so much value in starting to pay attention to that, because I think we all do it. We're all busy, and we're going from one thing to the next, and we eat something and we feel like crap 2 hours later, but we don't put those connections together. So the more you can kind of start paying attention to, okay, how did that, I ate that, and now I feel like garbage. So that's telling you something, right? And a lot of times that is like inflammation happening, or, so going back to that gut microbiome thing, I could talk forever about that, because it's so impactful. The things that we're eating, it affects everything. So you are what you eat is absolutely true.
You haven't talked about cooking certain things certain ways. Like, you have, you're cooking a steak. Is it better to toast driven it? Put it in the frying pan?
Well, I'm all plant-based, so I can't speak to how to cook a steak. So, but yeah, I mean, how you cook things matters for sure. So using good oils or no oil, that's the best way to do it. When you look at these areas in the world where people tend to live the longest, these blue zones, so if you're interested in that, there's a lot of books and magazines and all of these research that's been done on these areas in the world where people tend to live the longest. And they're not all vegan. There's only one area in the world, Loma Linda, where they're vegetarian. But they're plant predominant. They eat mostly plants. And if they're going to eat meat, it's a little bit, and it's not every day, and it's clean, So, and they're using things like extra virgin olive oil or avocado oils, things like that, but not too much. So it's really, the way that you prepare your food is definitely important. So using those cleaner oils, and if you can get away with using no oil, that's probably even better. Yeah.
So I have two. One was like maybe we could find a directory of who would be telehealth nutritionists here. So I know that's not ideal, but that's a little bit of bridging the gap. And then I was wondering if you can kind of touch base a little bit on alcohol intake in diabetes, because I understand that that's not good together, but I was wondering, because some people still want to drink on occasion.
Sure. So it's a good question with the alcohol. So the nutrition thing, Zoom, yes, we should talk about that. And that's okay. Yeah, and so the more we can support these programs and the more people show up, the more likely they are to stick around. So this is the problem, is like, nobody shows up. And so we, Gail and I were worried that we're going to be the only two sitting here. So this is great. We really want everybody to utilize the things that we're doing. So the more we can show up for each other, the better. But with regard to alcohol, it's full of sugar too, so it's going to spike your blood sugar. There's lots of research that's been going around about alcohol. We used to say a glass of wine per night for a woman and 2 glasses of wine per night for a man is good for your heart. And the more research that's being done and the more data that's coming out is no amount is safe. So that's kind of that's what I recommend now. Not to say that I don't drink. I'm not being high and mighty. I have a glass of wine here and there, but it definitely is going to play a role in your overall health and well-being, not just your blood sugar, but we know it increases your risk of cancers and things like that. So it's better to not, and if you're going to, really limit it.
Do you have handouts for anything you said tonight?
Pardon?
You have handouts.
Don't have any handouts. I should. We can, I know. I'll do it next time. Yeah, Natalie.
We did record this on our YouTube channel, so it is going to live there. So if you missed something on a slide and you want to go back to that, it'll be on the Kathleen Allen Health YouTube channel. And we were live on Facebook as long as it all worked like it was supposed to. So it will be there too, and we'll reshare. And then if there are ideas for other topics that you're really interested in, please tell me, because we'll find someone to speak to it and do it. Because this is what we want to do. We want to do this once a month, and if it got really popular, we could do it more regularly than that even, but this is what we're trying to do, so.
Natalie had a question. Sorry, Natalie.
Well, I obviously just showed you the gut microbiome.
Ah.
It's also technology.
Yeah.
Go find it. My other question was, I feel like there's a lot of tactical marketing out there that's geared towards tracking us into thinking certain foods are healthy when they're not. What would be like a few of the top culprits that you could think of that you would advise us to look at the back of the label, maybe cereal instead of buying it all store?
Yeah, that's a good one. Cereal, granola, these sort of keto kind of products. I think anything that's highly processed, anything that you're going to find on a shelf that can live there for a year is probably not so great. So my rule of thumb is always try to stick to the fruits and veggies section, stick to the refrigerated section, and all of those products that are in the middle, those are all usually highly processed, and trying to stay away from those things. And just being a really good label reader, look at the label, read the ingredients, and if it's full of ingredients that you can't pronounce, it's probably not the best thing. Yeah.
Let him say that.
Lo que estaba tratando de decir la doctora ahorita es de tratar de enfocarse más a lo que es los vegetales y la sección del congelador. Por ejemplo, algunos productos que tratan de atraer la atención de uno es, por ejemplo, el cereal y la granola. Tratar de evitar esos dos productos y tratar de leer los ingredientes de cada producto que uno esté tratando de comprar o que vaya a consumir. Y si no puede pronunciar la palabra atrás del producto, es algo que no deberemos de estar consumiendo. Y tratar de evitar consumir cosas o comidas procesadas que se mantengan en el almacén por más de un año.
Well, I do have a lot of suggestions for that, and I think a lot of it, and this might be beyond what we want to talk about right now, but I do think that there is an addiction part of it for sure. I think like alcohol or whatever, it kind of like feeds this little inside space that needs filling. And I think a lot of times that's related to stress and maybe not sleeping well, and that emotional side of us that can kind of feel a little vacuous and empty sometimes, and we utilize those things to kind of fill that hole. So talking about, our emotional well-being is so integral into our physical well-being. We have so many things that happen to us that plays a role in how we show up in our life and the things that we do to kind of numb out that painful stuff, So I think all addiction sort of comes from that same, there's a book that I read one time, it's called The Hungry Ghost. It's like that part inside of us that hasn't been necessarily processed, the emotional stuff. It all plays a role in our mind, body, spirit connection. And so paying attention to when those feelings come up, like, is there a certain time of day that happens? It's like, maybe it's after you get off the phone with a family member, or sometimes it's like fighting up with a partner or whatever. Then that might be a trigger to go and eating that thing, or going and drinking that alcohol, or going and scrolling on our phone. So I think the more we can integrate our body, mind, and spirit and be present in our bodies and paying attention to what's happening in our mind and our body and our spirit, the more we can notice, like, why are we doing the things that we're doing? And that's the doorway to change. So it might be a little more than you bargained for, but that's what I think about that. Oh yeah, for sure. That's a whole other talk. So there's definitely lots of medicines that we use for diabetes, and there's newer ones that are out, the Ozempic type medicines that are really kind of in the popular news right now. So yes, if diet and exercise don't cut it and you're still struggling with high blood sugar, there's lots of medicines that we have that can help you with that. So I always talk about our body as a house, right? So our house sort of lays on this foundation of lifestyle, and it's diet and exercise and sleep and how we manage our stress and our substance use, alcohol, tobacco, drugs, and our social connection. These are the pillars that sort of lay the foundation of our health house. And the medicines are sort of what we throw in the windows. But if those foundational things aren't solid, those medicines they're not gonna solve it, right? They're a Band-Aid. They're not the underlying cause. So yes, there's lots of medicines that we use, and they do help save people's lives, and they do improve outcomes. But if your foundation isn't solid, the medicines are never gonna be as effective. So that's really why I wanted to spend so much of my time talking about that foundation. And then the medicines, yeah, there's lots of them. So.
When do you think you should start?
Oh, when do you think you should start?
When do you? Is that what you say, when?
You know, do you base it on A1C or?
Yeah, that's what I.
Yeah. Oh, sorry. Okay. So if it's a new patient that comes into me, everybody has their way that they practice, the way that I do it. If it's a new patient and their A1C, so I didn't even talk about A1C, that's a 3-month marker of how high your blood sugar has been. So an A1C of 5.7 to 6.3% is considered pre-diabetic. So if a patient comes into me and I check their A1C as a part of a yearly panel, and it's in the pre-diabetic range, we have this talk. We have this foundational pillars talk. And we say, okay, come back in 3 months, 4 months, 5 months, depending on the patient's preference, really, and let's check it again. And if it's trending in the right direction, I am like your biggest cheerleader. Let's keep going with that. But if it's trending the wrong way, or if you come in with an A1C of like 9, which means that your blood sugar is like in the 250 range or 300 range for the most of the time, then I usually recommend starting a medicine and in the same time working on the lifestyle stuff. So it really depends on how you show up and one, your motivation. So some patients will just say, I'm not going to do any of that. I just know myself. And so I have to meet you where you're at, you know, and so that's okay too. There's no judgment. It's just every patient's so different. So I really try to empower every patient to take control, because it is such a preventable, treatable thing with lifestyle. I've seen patients, one of my patients, my most striking example, he came in, he's an engineer. This was on the mainland. But he's like the guy that will take things to the nth degree. You know, whatever I say, he'll do it times 10. So we talked about all these things. He had an A1C of like 5.9 when he came in. And then 3 months later, it was like 4. It was so low. I'd never seen anything like it, but he did every single thing that I talked about to the nth degree. And he switched it around, and he's still doing the same thing. We're still friends. And but you can change the trajectory. It just really depends on you, you know. So yeah.
Question, so like you're doing the lifestyle changes, but you're on medication. How do you know like that the medication needs to be lowered, or you're starting to like taper? Will you feel different in like your blood sugar? Like would it be too much? Like
Yeah, well, a lot of so like metformin, for example, that's one of the more common medications that we use for type 2 diabetes, and it's a really good medicine because it doesn't cause the hypoglycemia, or that picture that we saw that didn't have very many blue dots. So that low blood sugar, it doesn't really cause that. So, you know, as you're working on your lifestyle stuff, you're not going to necessarily feel low blood sugar with the metformin on board. The only way to really know is that if you feel like you're solid and you feel like, I got this on my own, then I kind of titrate off, and then we watch it over time. That's how I do it. Yeah. Questions? Does anybody want to get their blood sugar taken? We're ready. Let's do it.
And there's also snacks over there that are Calorie and Crunch that is made by someone who is diabetic, so it's low sugar, things that is good for you, and so whatever's there, please try and take a sample.
Thanks for coming, everybody.